Hi, and welcome to the How to Survive Healthcare podcast. I'm your host, Kayla Thompson-Riviere, seasoned critical care RN turned independent patient advocate. Tune in every week so that you can learn the things about the U.S. healthcare system that no one ever tells you. That way that you can get the most from it and optimize your health outcomes. Now, of course, this podcast is strictly to inform and entertain and should never be taken as a substitute for medical advice. Let's dive right in. Welcome back to another episode of How to Survive Healthcare. Today, I want to talk to you about an issue that is near and dear to my heart, and that's medical errors. Now, I like to share some statistics, but I have to put out a disclaimer first. We really don't know the true numbers of how many people are impacted by medical error every year because it's not something that's really well tracked, which in of itself is just mind-boggling to me. But according to a study put out by Johns Hopkins, approximately 250,000 people lose their lives for preventable medical errors every year. Furthermore, an estimated 1.5 million are left with some level of permanent harm from medical errors. So this is something that is affecting a ton of people. And that being said, it's something you really need to be on the lookout for yourself, for your loved one, as you're entering the healthcare system. So I first want to just go over some of the most common areas where we see these medical errors and let you know what to be on the lookout for. So first and foremost, medication. Medication error come in a variety of ways. Some of the most common being the wrong drug, the wrong dose, the wrong time, given to the wrong patient, or some potential missed interaction, either interactions between two meds or between a med and an allergy that you have that could. Secondly, we've got delayed or misdiagnosis. This, of course, delays your or appropriate care for the condition that you do have, which makes you sicker for longer. Third place we see errors a lot of times is surgical errors. This could be in the form of having the wrong surgery done or on the wrong body parts, or again, on the wrong patient. It's wild. Some of these things are like, how could that be? But there's people every year who, for instance, the knee replacement is found on the wrong side. Mind-boggling. I actually just saw an article recently. A man in Florida, I believe. Yeah, he was from Alabama, traveling to Florida. It's just happened in August, and started having some pain. The doctors diagnosed him something wrong in his spleen, and they needed to get it out emergently. And when they went in to go take out the spleen, they accidentally took out the liver instead, which again, I don't ever think on how, I mean, I'm not a surgeon, but I, you would think that major organ anatomy is part of the fundamentals of surgeons. These are all the things, that's what I'm getting at, that you wouldn't even think to be on the lookout for. Not specifically in that scenario, I don't know how you could prevent that without being in the OR. But I share this just to point out that you really can't assume anything in healthcare, and you have to be very vigilant in verifying that appropriate care is being given at all times. So, anyways, I digress. That was a tangent just to show the magnitude of some of these errors that, again, you just really piss. I couldn't come up with this with my wildest imagination. Um, fourth fourth most common place that we see medical errors is lab results. Where the lab is resulting something inappropriately, which then changes the plan of care and puts the patient at harm. I had this happen actually one time when I was caring for a patient in intensive care. The lab told us that her result of how thin her blood was critically low, meaning her blood wasn't thin at all. and we were giving her blood thinners. And so we gave her more and more blood thinners to try to get it to where we need it. And then they all back a couple hours later. They said, "So actually, her level was too high and her blood was too thin." And then we had thinned it further. So that's just another example of lab results where they can get the last most common place that we see medical error occur is around discharge planning. Either the instructions are insufficient, the patient doesn't understand, and then they go home and have more subsequent issues, or perhaps there wasn't sufficient discharge plan put in place, and what the patient went home, what you went home with, really wasn't safe. So those are the biggest areas to kind of be on the lookout. So I'm going to talk about next how you identify some medical errors and to do about it. But before I do that, I just want to take a pause and mention that the old adage, an ounce of prevention is worth a pound of cure. Now, you as the person interacting with the healthcare system, you don't have the capacity to prevent every medical error. However, in being aware and having some understanding of what to do next, rapid intervention can help to curb how significant the level of harm is to the person who received the medical error. That being said, vigilance is the most proactive approach to preventing medical error. Always ask clarifying questions, and always have somebody with you. At least a family member or a friend, but ideally a clinically trained advocate. Because a clinically trained advocate like myself or somebody else who has a healthcare background and steps into independent patient advocacy, we are able to sniff things out and spot things that you may perhaps be completely unaware of, and be taking even more proactive approach, making sure that everything with your care plan is appropriate. So that being said, I now want to talk about some of the ways that you can identify medical errors. Now, this was definitely an area of which we had a crystal ball, because all these things I'm going to mention here, I just want to be clear, if they're happening to you, it does not necessarily indicate that there is a medical error. I just want to be very clear about that. These are just things that, would warrant further attention and questioning, because these are some red flags for medical error, but they're not, it's not a be all end all. Okay. So number one, my favorite one, trust your gut. I firmly hold the belief that you as the patient, you are the expert in your own body, of your own body. You have been living in your body for your entire life. If something feels off, you're going to be the first one to know, even if you can't put your finger on what it is. Furthermore, if we're talking about your family member or your close friends being the one who is the patient in the bed, and you just get a bad feeling, or you think that they're not, there's just something is off, there really is science behind that. Our brain does not have the capacity to absolutely categorize every experience that we've ever had and tuck it away in a file and, be able to pull it out and recall exactly what happened. However, it does categorize memory and experience, a lot of memory and experience in our subconscious. So what does that mean? Well, when you get that feeling, that gut feeling, it actually is your brain recalling a past experience and bringing it to your attention, just without the crystal clarity of, well, on this day and at this time, this thing happened. So don't write off of that instinct, and don't let somebody else tell you not to believe it. Again, it doesn't mean that a medical error happens, but if it's making the hairs on the back of your neck stand up, there's probably a good reason for that. Um, Number two thing to look out for, worsening symptoms. Again, sometimes this too happens. Not all medical interventions, have the benefit that we are hoping they will. However, can be a red flag of maybe there was some sort of an error that wasn't disclosed. Look, most of the time when that healthcare team is implementing something with your care, we're hoping for things to get better. So if they're not, that's a concern. Number three, inconsistent information. While again, not a smoking gun, I'm big red flag. If you're getting different story from different providers, if you start asking questions about perhaps you ended up feeling and now you're asking questions, and the nurse is saying this and the doctor is saying that, again, different levels of expertise, but follow your gut on this. If there's really something is not jiving, ask more questions. Get the hospital patient advocate involved. Get an independent patient advocate involved. But keep going with that because inconsistencies around this medical story shouldn't be there. Unexpected side effects is our fourth thing we're looking out for. Again, that kind of goes along with worsening symptoms. Sometimes, unfortunately, just something that happens. But if you were having a treatment for something and they said, oh, no, the side effects of it are A, B, C, and you didn't get any of those, but you start having these issues, X, Y, Z over here, maybe you didn't get treatment that you were told you were going to get. Warrants further questioning. And lastly, review your record and see what they say, because you'll be surprised. Sometimes the error is right there in the open and the team isn't even aware that it occurred. So always look at your records. That can be a whole challenge in itself, but I encourage you to power yourself with the information. So those are the ways that you can help to identify the potential of a medical error. So let's say you've identified something, you think there was an issue with surgery, symptoms are worsening, there's side effects that you weren't told about ahead of time, and when you're asking questions, you're getting inconsistent information. What do you do next? So first and foremost, speak up immediately. Do not wait. Medical errors are something where, although, there's a human element and humans will make errors. And although some level of error is probably, can't be eradicated completely, the quicker we are at identifying it and then taking the appropriate corrective action, the more we can minimize harm to the patient. So speak up immediately. Number two, document everything. And this is where you can start to see where it's incredibly helpful to have that second person involved. Again, whether it be a family member or ideally a clinically trained independent advocate. So if they can document everything, do speaking up, and focus on managing the issues while you focus on your recovery. On the note of speaking up and documenting, I just want to say that you have to approach with caution. In my experience, a lot of healthcare providers, but typically physicians and especially surgeons, can be really put up a wall if they start to feel like they're being questioned. So the tone that I recommend is respectful but assertive, and also don't back down. There's always a way to word things nicely. That part of the reason it's helpful to have kind of a neutral third party to help take the emotions away from it, to approach the situation rationally. but maintain that level of assertiveness. Third, consider getting a second opinion. Ideally, out of the healthcare system that you're currently in. Most hospitals and physicians nowadays are practicing within a larger network of hospitals and outpatient facilities. And a lot of times there's some red tape around that. You're a lot more likely to get an unadulterated opinion of the situation if it's from somebody who is completely separate from that net. So that's all I'll say on that. Number 4, get your record. Get them. You can see some things in the health portal, but if you're suspicious that there truly is some sort of medical error, you're gonna want to actually go to the medical records department and request your records that way. Because not everything that is part of your permanent health record is actually displayed through the portal. That's another thing I would love to see change over the years. But know that you can go to the hospital system itself and get your record. And so a lot of times there is a fee associated with that. Just be advised. And lastly, I know I've said this before, but seek for guidance of an advocate. Ideally, one that either clinically trained, meaning has your healthcare background, a nurse, a doctor, a PA, something like that, or somebody who is an expert in your condition. For instance, there's a condition called Ehlers-Danlos syndrome, which is sort of a rare genetic issue. And I know a couple of advocates who they don't have a clinical background, but they're so well versed in Ehlers-Danlos and the treatment of it as the common issues around it that if I had a client with Ehlers-Danlos, I would certainly be consulting with them, even though they don't have any official letters behind them. So always take in the level of training and expertise and not just the accreditation. So those are some of the steps you can do if you suspect medical error. Again, I would really encourage you if you have a plan, especially with a planned surgery coming up or some other level of preparation around your healthcare, really consider getting an advocate involved. You wouldn't go to court without a lawyer, and you shouldn't go to healthcare without an advocate. So if this was helpful, please share this information with somebody you know and love. Medical errors run rampant, and we don't know who to touch next. If this is something you need help with, please don't hesitate to reach out. heardforlife.com, or you can find me, Heard for Life, here with Thompson-Riviere, on any of our social channels. All right, guys, take care, and I will see you next week.